ACL, anterior cruciate ligament surgery, has become very, very popular, very, very common. But personally, I feel at least 99% of the ACL injuries don't need surgery. Why this is happening? Because the moment anybody gets a knee injury, he goes straight to MRI and then goes to surgeon. He knows only to repair. If a ACL ligament is not in proper, it got torn, yes, it is his duty to reconstruct and repair. But in my experience, thousands of people, even a very serious grade 3 level ACL injury also, they recover. But you require patience and time and careful rehabilitation. So what is happening? In my experience, 99% don't require surgery. Even that 1% is also in a motorcycle accidents are very, very, very dangerous injury. Injuries can happen in a very abnormal way. So MRIs normally overread ACL injury. When MRI was not there, how we used to treat army people, sports teams, thousands of people I have seen. Only clinical examination. Nicely examine where ACL is injured or not. Draw sign, just pull and see. ACL is a ligament which helps to kick and lift your leg in front. But selective rehabilitation, if you don't do, then they don't recover also even after surgery. Per se, if you undergone surgery, you are doing an exercise both for right leg and left leg, same exercise. So the affected leg will remain weak, the other leg becomes stronger because body uses that. So what happens over the time? You will become a langda. One leg becomes thin, other leg is stronger. This difference in the strength and the balance of the muscle will continue and other leg will get injured. So rule number 1, don't be in hurry to take an MRI. Wait for 2-3 weeks. See, is it becoming worse or is it becoming better? Any bony injuries are very easy to make out. The swelling, blue color and everything will come to know, and sprains also will be very severe, but they all mostly recover in about 2 weeks, 3 weeks time. In a normal course of game injury, fell down, slipped, don't have to run for MRI. Yes, motorcycle accident or a fell from a height, yes, you may have to look into it. Even MRI says if your ACL is injured, wait, no hurry. 72 hours cold pack, after that contrast bath, support, brace and selective conditioning of the knee joint. In 3 months time, 99% of people very easily able to walk. I have hundreds of people. In fact, my own ACLs are not seen even now on MRIs. Sorry, MRI को इतना ज़्यादा believe मत करो. It is good to detect a tumor or a very soft tissue delineation, some kind of serious injury, serious disease. There are so many benefits of MRI, but not only for ACL. Meniscal injuries, yes, the clicking sound, slipping, knee getting locked. You fold your knee, it gets locked in one angle. Maybe meniscal injury there. It needs further examination and investigation. But for God's sake, ACL doesn't require surgery in most of the cases unless it is very severe. Person is not able to stand, is not able to turn. You can easily make out who needs surgery. I hope you take care.